My name is Shwetha Iyer. I'm the Program Director for the Primary Care Social Internal Medicine Program at Einstein Montefiore. So the residency program in social medicine encompasses 3 tracks, and the primary care social internal medicine track is one of those tracks. The social medicine part of the program has its roots in community activism and really took the lead of the Young Lords and Black Panthers movement in the 1960s and 70s, who paved the way and spearheaded tons of initiatives for the local community members to advocate on their behalf for better health care in the community. So these movements really served as the birth of many of the community-based organizations in the Bronx. And over the past 50 years, the social medicine program has really tried to integrate our curriculum with these community initiatives. And in order to not only understand what the structural barriers are to the care of community members, but to understand the strengths of the community and to help empower patients to get better care, to get better access to care, and to help physicians be better advocates for the community. We recently met to work on the mission statement for our specific track. And we enlisted the help of faculty, residents, and community leaders. And this process really illuminated many of our core values and really the culture of our program. What we discovered is that we want to make sure we're meeting the needs of developing physicians in training while we're also meeting the needs of the community that we serve. And so one of the most important things that was highlighted during this process is the collaborative nature of the program. And so on a very individual level, we collaborate with residents multiple times a year to develop individualized learning programs and really to foster growth in their own learning over the course of 3 years. In addition to meeting with residents individually over the course of the year, our faculty also provides support both in the care of patients and also in mentorship of many of the projects that our residents take on. We've also been incredibly fortunate to work with the Division of General Internal Medicine and the Department of Family and Social Medicine, both who've provided incredible mentorship in research and in residence training over the course of 3 years. I often get the question, what is the best part of our program? And without a doubt, I have to say that it is our residents. Our residents bring in such incredible life experience. They really have the finger on the pulse of what's happening day to day in the world, and they have incredible creative ideas to improve the care that our patients are receiving. Many of those ideas have become social medicine projects over the years and continue to thrive in both our clinic and our program today. In order to really tap into residents' creative ideas and to get their feedback, we meet with our residents every year, class by class, get some feedback, and get ideas on new curricular initiatives and programming. And we get to work right away working on those changes. We know that medicine is really constantly changing, and we want to mirror your education to reflect those changes and to make sure that we're meeting your needs as you develop as a physician. Our role really is to train residents to be successful in whatever post-residency career they choose. So many of our residents have chosen different and varied paths, ranging from traditional clinician educator jobs to distinguished research careers, either through general medicine fellowships or the National Clinical Scholars Program. Some of our residents have gone into primary care leaning fellowships, including HIV care, geriatrics, or palliative care. And many of our residents have gone on to become leaders in public health positions all around the country. Our website actually details what many of our graduates are doing. We're also happy to connect you with our alumni who can share their experiences from the program and the work that they're doing today. When I think about social medicine, I really think about partnering with the community And I know that many of the residents who come here are very eager to know the history of the South Bronx, what changes have happened over the years in the care of patients, and how they can really get involved in advocating for the community. And so when I think of the ideal resident who would fit very naturally here, it's that resident who has taken a huge interest in understanding the community, what their needs are, and how they can really help advocate and improve access and care of the patients in the community.